Okay, Aditi, how big do you think this achievement is for us, you know, this whole pentavalent vaccine, and how important it is for a country like India, where large numbers of children die because of these deadly diseases? Our children are vulnerable and the stakes are higher when we compare ourselves to developed countries.
Yeah, absolutely. As the two very good experts have pointed out, that the pentavalent vaccine is really, you know, going to revolutionize the way public health is delivered in our country. And Dr. Arora was very right in pointing out that it's the most effective way of reaching the poor populations. Because how do you treat diseases? You treat diseases either through medicine or you treat them through vaccines. Now, the structure of public health is such in our country, due to poverty, due to, you know, lack of access to all kind of places. Terrains are difficult in the northeast, in Jammu and Kashmir regions. You know, generally human resource crunch is there.
Right.
So medicines and antibiotics, for instance, you take the case of pneumonia. How many children are actually reaching the healthcare facility? If you are detected with pneumonia, first the diagnosis is a problem.
Right.
Secondly, even if you are diagnosed, you don't reach the healthcare facility. Thirdly, even if you reach, UNICEF has estimated that only 1 in every 5 children who are detected with pneumonia actually get antibiotics.
Right.
So vaccine, that's how I see it, what Dr. Arora has just said, that vaccine is the most effective way of prevention. Because why do you go up to treatment? Let's prevent. So in that connection, the pentavalent vaccine, as I said, will revolutionize the way we, you know, deliver public health in our country.
Okay.
And let us not forget that, you know, when we have to talk of the Millennium Development Goal number 4,
Right.
which specifically deals with under 5 mortality of children, you know, children under 5 years of age. And India leads the world in that tally. I mean, we have the highest under 5 child mortality rates in the whole world.
Right.
And we also supposedly have the highest pneumonia deaths in the world. So when you see everything in perspective, for us to achieve the Millennium Development Goal,
Right.
the pentavalent vaccine's efficacy, its importance cannot be overestimated. It's a very important vaccine.
And as they say, prevention is better than cure.
Yeah.
But Dr. Paul, if we could look at some of the concerns around the pentavalent vaccine, we've been hearing a lot of criticism about it. Deaths have been reported in countries such as Sri Lanka, Pakistan, Bhutan, Vietnam, and also in the state of Kerala. How do you look at these reports? Is it a genuine or fair criticism?
I think first is that we must recognize the fact that when our nation, or for that matter any nation, introduces such vaccines, it is based on a very clear understanding that this will give us a very overwhelming benefit. It will save many, many lives. And that has been done by our country through the most impeccable system under the Indian Council of Medical Research at the direction of the Supreme Court of India. The experts, the top experts, and with high level of integrity, looked at it in a scientific manner. And the first and foremost, therefore, is that when we went into it, we weighed the pros and cons, and we were very clear that the benefits are absolutely overwhelming compared to the risk that might be there. Second, we are not the first country to introduce pentavalent vaccine. We are among the perhaps among the last bunch of countries that are introducing pentavalent vaccine. There's a huge experience available across the country, in our own region, where this has been used and it has been found to be helping, say, babies. And last but not the least, another consideration, the private sector of this country and the rich people were accessing this vaccine for many years already.
Right.
So first part is that when we go into it, we have already looked into it in a systematic way. It's not a trivial decision which was taken by this country.
Okay.
The second part is that like any medicine, any product that's available in today's time and forever, perhaps, there will always be some issues around it.
Okay.
There will be some minuscule chance of problem.
Okay.
Some are related to the vaccine per se, which is even more rare, rarest of the air. Sometimes there are issues about how we deliver it.
Right.
So there are things that could happen, go wrong with the vaccine. Occasional, 1 in a million, 1 in 10 million.
Okay.
And Dr. Arora is expert in this area, and I think he would be the best person to allude to this. But the other part is that sometimes problems occur because the injection issue may be there. So I think we need to distinguish, and I think Dr. Arora can actually highlight and and really crystallize this issue, that whatever little we have seen as way of adverse effects and problems, what are they due to? But I want to emphasize that this decision, when taken, is based on our core belief that it's scientifically valid, and millions of other individuals across the world have accessed this vaccine and have made use of it.
So parents need not panic about
and then we'll discuss
the fallouts of this vaccine. And as you said, benefits here far outweigh the risks, which are minuscule.
And public health decisions are not based on an individual risk. Public health decisions are based on the larger good, and a very large good. And that's the basis of public health decision. This is not an individual decision one-to-one. And that's the paradigm that has been used the world over. This is the modern paradigm.
Right.
And therefore, we are into a very, very safe ground. And of course, whatever has happened, we should discuss that. And I think Dr. Arora can throw light on
that. Dr. Arora, let's focus on the question of the deaths first. What does the global experience tell us? Because in Bhutan, we understand 8 children have died. There have been 25 instances of serious adverse effects in Sri Lanka. There were 3 deaths from Pakistan. 10 children suffered in Vietnam. And, the estimates from Kerala are varying. Some are saying 12, some say 15, some even say 21 children have died. What would you say about these concerns?
So, first of all, I would like to correct you. So, we say so many events have been reported, and causality, whether they are because of the vaccine or not, I think that also is a very important issue. Because if I find that deaths are occurring because of a particular vaccine, then I am worried. But the fact of the matter is, whether it was Pakistan or Bangladesh, Bhutan,
right,
or Sri Lanka or Vietnam, in all these places, after very extensive local as well as international causality assessment, investigations of the death, it was conclusively proven that none of these deaths are because of the vaccine, pentavalent vaccine. The second thing, one important thing which came up in Sri Lanka recently, that if a child has a congenital heart disease, then probably the vaccine should not be given, because there was a unusual association with a possibility of death in those kids who had congenital heart disease. Now, the story actually, beyond that, there is very little. Now, coming to the issue of deaths in Kerala, in a few, 2 or 3 deaths have occurred in Tamil Nadu.
Right.
Few deaths have been reported from Haryana recently. A death was reported from J&K also.
Right.
Now, let's understand what is apprehended, what is going on in the community, and how does that superimpose on top of that in terms of these reportings. The nearest cohort, like India, we have an annual birth cohort of 26 million, while in China the birth cohort is between 16 to 18 million. For a 16 to 18 million children who are immunized, their immunization rates are better than ours. They report 40,000 AEFIs per year, out of which about 4,000 are serious AEFIs. That means so-called deaths and hospitalizations.
Right.
On the other hand, we are reporting just around 200 or so serious AEFIs. In India, the expected serious AEFIs for 26 million deaths is about around same, 4,000. Now, question is, are these deaths associated, or these hospitalizations associated with the vaccine risk? And this includes all the vaccines. It includes DPT, it includes measles, it includes BCG also. Now, in countries where the surveillance for this kind of side effects of the vaccine is poor, which is still evolving, then the possibility of panic occurring with these reportings is very high. Now, if you take the example of whether Pakistan or Vietnam, Bhutan, even Sri Lanka, the AEFI systems are evolving. Probably India is no better. Actually, before 2005, we had very, very poor the AEFI surveillance. It is only from 2005 onwards that we have gradually started reporting. We have set up a system. Now today there are AEFI committees at the national level, state level and district level.
Okay.
And the guidelines are available. The recent guidelines are repeated just about a year ago. So the system is just getting in place.
Okay.
Now in a place where AEFI surveillance does not exist, but there is heightened awareness that some deaths have been reported from one country or the other country.
Right.
Then similar kind of, there is a greater kind of awareness and reporting starts occurring. And something very similar seems to be occurring in our country also.
Okay.
Now all the deaths which have occurred in our country, they have been systematically in a scientific manner have been investigated and causality assessments have been done.
Okay.
And fortunately,
it has nothing to do with the vaccine.
and we have not found any causal association. There are certain types of deaths which are occurring, and I think we will discuss it as we move
Dr.
forward.
Arora, I have to interrupt you here. We have to take a break in the program. Stay with us. Our discussion continues on the other side.